This conference will now be recorded.
So, welcome in the techniques for the counseling in the part 3. Okay, so today our task will be a unique task. We will not run just, a classic sessions or a presentation of this and that. No, what we are going to do is 2 volunteers or 3 volunteers can join us today. You will be required to discuss some particular part of the task, okay, with the timer on, and we will see how have you done, okay, in your technique. So like, for example, okay, if in one of the stations that is taking history, so taking history should be maximum at 4 minutes, okay, so the candidate will be only allowed 4 minutes to take the history, and then we will give a feedback according to that. If the task is to negotiate or to have agreed plan with your patient, okay, so the task will be like, for example, 4 to 5 minutes for this, okay, to discuss the management plan for the patient and closing the station. That will be also with the timer on, and after this we will discuss or give the feedback about the performance. Okay, so that's why we are doing that, because simply, guys, now you are grown up and everyone have a good idea or a decent idea about the part 3. Okay, so I don't want to go to the classic, 10 minutes waiting to give a feedback. Some candidates are really struggling still at the very fundamental, techniques or the skills for this part 3. And I don't want to interrupt anybody, but we can divide the station into 2 or 3 parts, the important points, and to focus on this and give the feedback. So the stations I have choose today is actually a re-exam station, as I told you, very common and have a heavy communication, part of it. Okay, and this is what we expect to see actually in oncology stations in the exam. Okay, so who would like to be my first volunteer today? Today I will be the role player. Okay, till we have a good preparation for the role player technique. Anybody will say me? Okay, so let me choose. So Dr. Sania, are you ready? Okay, not yet. Okay, so guys, anybody would say me? Yeah, hello. Hello, dear. Please come on. It's Dr.
Yes, ma'am.
Jaya.
I do. Yes, ma'am.
Hi, how are you? Okay,
Yeah.
so let's come on.
Yeah.
So yeah, in this case, in this task, as you can see, okay, so in this task, you are required to discuss the patient concern and outline the management plan. Your patient is tested for the BRCA gene, okay, and the report came to be positive, okay. So
Yeah.
what I need you to do is, in the first 2 minutes, okay, I need a good introduction
Yes,
to
ma'am.
this task, okay. Um, setting the agenda, as we all know, okay, and set the purpose of the discussion today, okay. Ask the patient about her concerns, and that's it in the 2 minutes.
Okay. Here, may I start, ma'am?
Yeah, 1 second, because yeah, I set my timer.
Uh,
Please start.
Hello, I'm Dr. Gayatri, one of the doctors in the gynecology clinic today. May I confirm your name and age, please?
Hello, doctor. This is Sarah Jones, and I'm 25 years.
Okay, and how would you like me to address you?
Sarah's fine, doctor.
Okay, Sarah. So I understand that you have undergone a testing for BRCA gene and you are here to discuss the results regarding the same. Am I right?
Yeah, yes, doctor, it's correct.
Okay. I will discuss the report in a while. Is there anyone that's accompanying you today?
No, doctor, I came myself.
Mm.
You know,
Could you?
I'm very much
Yeah.
expecting the result of today.
Okay, okay, Sarah. So could you tell me about your concerns? Why did you undergo this test?
Yeah, doctor, it's actually because my sister had been diagnosed recently with breast cancer. I have aunt as well that she
Mm,
had ovarian cancer and she died for it.
mm,
So the doctor told us that after discussing the family history, he told us that we need to run a gene testing. Okay,
I'm
so
really sorry, Sister
yeah,
Sarah. My
yeah.
condolences.
I was
Did
saying,
anyone suffer from the similar disease in your family?
sorry.
Did anyone else have similar cancers in your family?
Actually, yeah, we had some different, you know, persons with different cancers. But since my sister, she was young when she got that.
Okay.
Okay, so just 2 minutes finished. But yeah, so my sister was young when she got that, and she has been tested for the gene. It's called the BRCA gene,
Mhm,
and her result is positive. So they told us we have to be tested as well.
Okay. Okay. Do you have any other illness? Are you visiting a GP for any other illness?
Now, I should stop you here.
Okay.
Okay. Because our time is finished and we need to discuss
Okay.
this in minutes. Okay, so what do you think?
I took a bit of time. Maybe I should not have asked about is there anyone accompanying you? I could have done with the BBN when it is coming. That maybe would have saved some time, and I could have been a bit more faster in the presentation maybe.
Okay, okay. So I'll tell you something. I liked your introduction, okay, and your way and your tone, your way for speaking and your tone was good. However, okay, yes, it's a question that you ask yourself: is it a breaking bad news or not? Right? So should I say, I'm so sorry to be the barrier of the news and all of this in that situation for a patient that had been tested positive for a gene like that? This is one question. Another question is because she's not diseased at the moment, she doesn't have a disease at the moment. She had some maybe unexpected news, but even in this case, this patient, she comes and she said that she is very much expecting the result. Okay, so this is a question you ask yourself outside the cubicle before you go and meet the patient. Sometimes not clear. Okay, so if it is not clear, so who is going to give you the information? More information.
The, the patient we have to talk.
Yes, yes, dear. So it's the patient herself. Okay,
Mm,
so the patient give us the information, and the only way that we understand her understanding, okay, or we get to know what's the level of understanding in her is to ask her. Okay, so we have, guys, it's like, in the exam you have one or two papers with the task in it. If there is information that's missing or something that is not clear, you have the role player there with her brief. She had a lot of information to tell you, but you just ask correctly about it. So if you are going to this patient, introduce yourself and, ask her about her concerns in this visit. She will start to tell you something. She will start to tell you about the why she's here today. This is very important. Okay, from that you will understand why she's here and what's my role, what's her expectation, what's her concerns, right? So this is very important. I don't want you to go with the station while you're saying this is a breaking bad news, I have to break the news and I will do this and that. So please try to elicit more information from the role player by asking her the correct questions. Okay, so the correct questions to be asked is to understand the patient, the purpose of this consultation, why the patient is here, and you had an agreement together before you go take history or do anything else about what is this consultation will be all about today. Like, for example, I am here for, if we are doing this again, so I will tell you as a patient, okay, doctor, I'm here to discuss this report. What is the meaning of having this, or what is the implication of having this BRCA gene? I don't want to have cancer, okay, and I want to do anything to prevent that, okay? So your role as a doctor now you understand what's requested from you. So now you understand that your task is to explain the risk of having a BRCA gene. Yes, and this is BRCA1, so it's the more risky type. Explaining this to her in a simple and clear language, okay, and to offer her what are the options for her, okay, in order risk reduction, okay. Will you offer her the risk reduction surgery? Will you offer her any kind of prophylaxis or anything else? Okay, so the patient here is simply to gain information about her condition, her risk, and what is the treatment. So this should be your task, and this is what you will explain to the patient. Okay, so yeah, I'll let me explain to you what is the BRCA gene and what is this meaning of having this BRCA1 carrier, what is the implication of that and the effect in your health in the future, and what we can do for this risk, okay, and in order to reduce this risk in the future. So this should be the sitting agenda. Okay, so you ask about the patient concern, understand why she's here today, then you give her the plan, okay, of your discussion today. So everything should be clear beforehand, everything should be clear before you go on with your usual history taking, your discussion of report, your whatever you want to do. Okay, please make it clear. At least when you make it clear like that, okay, the candidate, sorry, the examiner and the lay examiner, because usually in such cases with heavy communication, the lay examiner will be there, okay, and the lay examiner will, they call themselves patient advocate, okay, so they want everything to be clear, no jargon, nothing, okay, and simple language. Also, the patient or the role player in front of you, she will understand what are you going to do in this, okay, in this consultation. You can tell something like first, second, third, or I'm going to do this and that. Anything, enumerate what are you going to do, okay. Then after that, go into the discussion and the flow of the consultation. At least you gain the mark, okay, of the planning. Okay, dear, so this was good. Yeah, it can, I'm sure that you can do even better. When you have started your history, just it's outside of the 2 minutes. When you have started your history, you have asked the patient about any medical disease, right? Is that correct, Dr. Gaia? Gayatri. Is that your name correctly?
Gayatri, yes, ma'am.
Gayatri. Yeah, it's a nice name. Dear, you have started with you have any medical disorder, right?
Yes, ma'am. It was already given. I should not have asked.
Already
No medical.
given. Yeah, so please don't do that. Yes, correct. So avoid repeating the same thing. So if you want to ask about point in the history here, okay, so this patient, she had 2 children or she gave birth for 2, but it's not clear for you. You need to do that because the family history and the planning, future planning of family is very important in this case. She had no medical disorder, so we will not ask about this again. She's not smoker, not ask about the social. BMI is okay. Okay, you already have listed the information about the family history. Okay, well, it's already was given to you, but anyway, you have, explored more. No problem. Okay, so now you know what are the information in hand and what is remaining to ask about, right? So would you like to do the explanation?
No, ma'am. Next candidate will be.
Okay. If anybody else would like to do the explanation? Thank you, dear. Thank you very much for this chance. Hello. Anybody would like to explain to the patient? Yeah, Dr. Sani, I would love to, but it seems like you have an echo. Hello? Yeah, Dr. Sania, please check your device, okay? There is an echo from your side. We can't hear you. Guys, can anybody hear Dr. Sania? No, sorry. Okay. So anybody else would like to do? Oh, I'm sorry. Anybody else, guys, would like to explain the result?
Dr. Abba, I can try.
Yes, you please come. Okay.
All right. Shall I start?
Yeah, but I would like you to explain the result. Okay, if you don't mind, only okay, for 3 minutes, along with the implication on the health.
Okay. 3 minutes. Explaining the results and the implications.
Yeah.
Okay.
Kindly work on the background noise from your side. Okay.
Hello. Can you hear me clearly?
Yeah, I can hear. Okay. So let's start.
I'll just try.
Fine. Try whatever you want.
Okay. All right, Sarah. I have some difficult news for you. Before I discuss your result, would you like to have someone to be with you?
No, doctor, I'm fine.
Okay, Sarah. I would like to I have confirmed your name and your NHS number, and the results of the G testing belongs to you, and it has reported that you are tested positive for BRCA1. Do you understand what does it mean?
Actually, I have heard that before because it's the same diagnosis for my sister. As I told you,
All
I was
right.
expecting that.
Okay.
I don't understand really what is it BR.
All right. Okay, so there are some genes that is tested in a family when you have a family history of such as ovarian cancer or breast cancer. These genes, when it presents, is actually shows you you are at more risk of getting the similar cancer. All right, the risk is about 1 in every 2 for breast cancer, and about 1 in every 3 women in for ovarian cancer. Are you following so far?
Yes, doctor. So it's something like some fault in our body or something.
Yes, we have a genetic makeups in our body, and we have a lot of genetic material, and the genes. There are some genes that make you predispose you to certain cancer, and for your condition, it's a BRCA gene which predispose you to higher risk of getting ovarian cancer, breast cancer as well. So there are things that we could do um, to reduce your risk. Would you like me to discuss further?
Is that meaning that I must have cancer?
It doesn't mean that you have a cancer at this moment, but you have a risk, a higher chance of getting the cancer because of the because you carry this gene alteration.
Okay, so how to prevent that?
All right, there are first we would like you to put you on a screening program where we have to do a yearly. We encourage you to do self breast examination, and if you find any mass or any lumps, then you need to come to your GP where they would arrange you to do a scan or further investigation for that, and as well as there's a we will offer you to do a scan also on your tummy to see if you have uh, any uh, any swelling or things like any swelling that might put you at higher risk of if let's say if it's found to have a swelling, then you might need to earlier we can identify it earlier and treated it accordingly.
Okay, yeah, thank you. Yeah, I know that there's a lot of strategies to be discussed yet, okay, but as the 3 minutes was about the explanation and the implication of health, okay, of this diagnosis on the future health. So I'd like you, dear, to just follow some lines, if you don't mind, okay? So there's some lines that we'd like to follow in how to discuss with the patient what is the meaning of the BRCA gene and having the BRCA gene mutation, okay, and how to do this in a simple way, and how to go on the consultation with, you know, covering every point, because it's not only about the surgery, okay? So if the patient asks you what is the BRCA1 or the BRCA2 gene according to what she have already, so you start by giving her a background about the what is the genes. So simply, our body is made up of tiny building blocks that's called cells. Inside every cell there is a set of genes. These genes are the instruction of the cell need to work properly. BRCA1 and BRCA2 are two genes that everyone has. What happened when you have this mutation? When we have this structure in the gene, okay, so sometimes the structure inside a gene is permanently changed. This means that the gene no longer gives the correct instruction. So in this case, we call it a gene mutation, because actually the BRCA1 and BRCA2, this is something that every one of us have it. But what happens if we have the mutation? So the patient need to understand that she had the gene mutation, or the faulty gene as we call it. Okay, so the function of normal BRCA1 and BRCA2 genes normally is to protect us from the ovarian and breast cancer. And any mutation in one of these genes will means that this protection is lost. This may mean that cancer are more likely to develop. The risk is highest for the breast cancer, but it's also higher than average for the ovarian cancer and pancreatic cancer. It doesn't mean that the patient is guaranteed to have a cancer, or she will get a cancer 100% in her life, as you said. Okay, so we can't say that the chances is 6 to 7 in 10 to have the breast cancer, 4 to 5 to have this ovarian cancer. Your gene only partially influence your future health risk. Other factors such as medical history, lifestyle, and your environment also play a role. Why we have to mention that? Because they are very important part of the protection of cancer in the cases of the BRCA gene carriers, mutation carrier 1 or 2, is a lifestyle advices. Okay, so if you have one of the faulty BRCA gene, so 50% the chances that you will pass this to any of your children. So this is affected in the future. Okay, and she had to understand this point also because she had 2 children. Okay, and that's mean that her children as well as at risk, okay, of having this gene. So it's very important to understand the risk of inheritance. And 50% the chances that each of your sibling also has it. Okay, so the patient, if she doesn't have a sister with a diagnosis before, for example, okay, so that's mean her sibling need to be tested as well. This is why it's recommended that you speak to a genetic counselor. It's very important part of our management there, that the genetic counselor that to discuss with you and how is your family could be affected. So managing the risk if the woman has a positive test. Okay, so patient have a range of option to manage the risk. In the part 3 exam, we don't give one single answer or what is the best answer like the part 2 exam. In the part 3, we give range of management option and the patient has to choose, and our role is to provide the correct information so when the patient make a decision, that will be an informed decision, right? So not only surgery, okay? So risk reduction surgery is not the only option. Ultimately, there is no right or wrong answer about what you should do. It's a decision only that you can make. So number 1, as you said dear, a regular examination of the breast. That's very important. So the regular examination of the breast, this is a form of screening that's easy and cheap, and you can do that at home. So if the woman has the BRCA1 or gene mutation, it's a good idea that you would be aware the changes of the breast, okay? And she will be offered a mammogram, MRI scan, or both. Make sure it's not only about the ovarian cancer risk, the breast cancer risk is higher. So she must see a doctor, okay, that's specialized in this condition. Not only is a genetic counselor, she will see also a surgeon that's subspecialized in the breast, surgery. She will be also referred to a breast clinic, okay, because there is one-stop breast clinic almost all over the UK, in every place. So people who have high risk, they will go for regular checkup, mammograms, MRI, or fine needle aspiration if needed at any time. Okay, so no reliable screening test for the ovarian cancer. However, okay, we can advise a follow-up with the scan and the CA125. Lifestyle changes, that's very important. Okay, so the change of the lifestyle, like keeping healthy diet, exercising. She had a good BMI, so this is something that you should appreciate and reinforce it. Like keep on keeping your healthy weight and healthy diet, healthy lifestyle. Okay, so patients should avoid the oral contraceptive pills as well, and the combined form of HRT if she being tested, unless she's advised by the genetic counselor. Okay, so as well, reducing risk reduction surgery should be discussed with this patient. The risk reduction surgery is not only about the bilateral salpingophorectomy, okay, it's about the mastectomy again. So this is something that should be discussed with the surgeon. We will not discuss with her the mastectomy, but we need to discuss with her what is the implication of the risk reduction surgery from our side as obstetrician gynecologist. It will be removing her ovaries, and removing ovaries means that she will get into early menopause, right? So if she's getting into an early menopause, so that means she will need the menopause clinic, yes, and she can be offered HRT afterwards, but this is again, okay, will be with the MDTs, not our job at the moment. Very important, as I told you, part of the discussion is to cover the family planning options, okay? So if this patient, for example, she's nullipara and she has no children, but she is so keen to have the surgery to reduce her risk in the future, okay? So what you will tell her about the family planning, that's very important information, or it can be a question from the role player and you have to be ready to answer this, okay? So patient need to understand, as I told you, the risk of inheritance. That's very important. So the cancer risk gene can be passed to the children. Okay, this is very important. Some patient will refuse, okay, to have their own children, okay, because of this, because of the risk of inheritance. Some patient will ask for a pre-implantation genetic diagnosis if she is nulliparous and she wants to conceive before the risk reduction surgery. Okay, so this is very important actually to bring those options in the discussion with the patient. Okay, sometimes it's an option to be offered to them if they don't want to use their own eggs. Okay, so they can use a donor egg and to be tested to avoid passing the faulty gene. This will be, you know, a big question if it is asked. Okay, not all the stations you'll have to go through this in details, but I'm giving you this slide and it's actually, you know, the advice of the NHS, because if you have this discussion, you should be able to answer correctly, right? Either a structured discussion or in a role play if the patient comes to the family planning and what about the future fertility, I want to conceive, I want to have my own children, is there any risk for the children? Yes, there is a risk of passing the faulty gene, so what is my options? These are the options. Okay guys, is it clear so far? Any comments? Okay, so this is straightforward station, okay, and I hope that every one of you, I'll tell you what, okay, very important, if you want me to continue with you guys the practice, and I would love to, okay, because you know I'm so busy, I have children, I have work, I am working 2 jobs actually, okay, and I have to read every day to continue on the job. So between all of this, I can find time, but please encourage me, okay? Encourage me by your activity. So if I feel like there is interaction on the group and people send their homework in the form of, you know, recording this station we discuss afterwards, after the feedback and after they had the tips, so they record it correctly, I would be so much happy and I feel that, oh my God, my work is paid off, so I would be happy. Okay, so could you please give me this pleasure? Okay, thank you very much. Thank you guys. Okay, so let's see the next task. And the next task is a famous recall task. Okay, and come on, who would like to volunteer? Yes, Dr. Sanya, that will be important in any oncology station that you ask about the red flag signs of cancer. You know, the paraneoplastic syndrome, like bloating, like difficulty in digestion, fast or unexplained weight loss, okay? Any problem with the waterworks, any problem with the back passage. So this question needs to be asked, yes. Okay. Okay, so who would like to do the introduction, setting the purpose of the station, and start history taking from this patient in 4 minutes? Anybody would say yes?
Can I try, doctor?
Yes, sure, Dr. Asil. How are you? You're
Yes, I'm
welcome.
fine.
You're
I'm fine,
welcome.
thank you.
Okay, so if you'd like 1 minute or something to formulate your plan, I will be okay. Otherwise, if you want to start, tell me. I will start.
Okay, doctor. Yes, doctor, I am ready.
Okay, start.
Hello, I'm Dr. Athil. I'm one of the doctors uh, in the gynae clinic. Can I confirm your name and age, please?
Yeah, doctor, this is Sarah Jones and I'm 32 years.
Yes. How would you like me to address you?
Sarah is fine.
Sarah?
Yeah,
Yes, Sarah. Yes, Sarah, tell me why you are coming here to the clinic?
yeah, doctor, actually, what can I say? I have my friend who just died. She was my bestie and, you know, she just died from ovarian cancer. It was horrible. It was diagnosed at the fourth stage and it didn't take too much time. She had no time all for Maggie almost.
Oh,
So it was like it came like a shock to all of us. So I think that I should have my ovaries removed because I don't want to be in this experience. I don't want to suddenly be diagnosed with something like this.
yes, yes. Yes, I'm sorry to hear that about your friend, Sarah. Sarah, I want to ask you a few questions about your history. Tell me, Sarah, you have two children. From your history, I read that you have two children.
Yeah, yeah. They are 6 and 4 years.
Yes, and uh, uh, what are the mode of delivery?
It was normal.
Normal delivery. Okay, and do you take any contraception in this period?
Yeah, I'm on the pills, the combined pills.
Okay, fine. Tell me, Sarah, about your history. Do you have any medical disease that you are taking medicines with your GP for them?
Um, no, actually, I don't have any problem. I'm always fit and healthy.
Yes, that's good. Any allergy to medicines?
No, I don't have any allergies.
Okay. Tell me about your family. Do you have any family history of diseases like hypertension, high blood sugar?
No, no
Okay.
hypertension, no blood sugar.
Do you have any family member with who are were diagnosed before with cancer?
No, I don't have any.
Any family history? Do you have family history of a blood clot?
No, nothing.
Okay. Tell me about your period. Is it regular?
Yeah, my cycles are regular. I'm taking the pills and everything is fine.
Okay. Do you previously had diseases in your tummy and below? Infection?
No, nothing.
Do you have do you have a history of like do you receive a treatment for sexually transmitted disease?
No, why you will ask about something like that? I never seen anybody but except my husband.
Just to make sure that about your general health.
Okay, so your time is over, Dr. Asil. It's 4 minutes already over. Yeah, thank you. Okay, dear. So what do you think?
Yes. Continue. Can I continue, Doctor?
No.
Oh, oh.
Just tell me what you think.
I just take the history, Doctor. I want to explain her concern. I want to address her concern.
No worries. But you know, your task was you are starting to set the purpose of the station, make a rapport with the patient, and to take history. So this is the okay.
Yes. So the
So
history
this was
takes
your task.
long
Okay.
time.
Yeah, you will be assessed in these 4 minutes actually for your communication with the patient in the form of introduction, in the form of reacting or responding to her cues. Okay, so like the patient is crying, so as Dr. Huda, she said you offer wipes, tissue. Okay, when she's crying, believe me, this is you will be in the face-to-face exam most likely in the next exam, so you have this good chance of acting and communicating with the patient. Yeah, she need to see a counselor, yes, Dr. Hafiza. But this is part of the management, so let's focus on the communication. Okay. Okay, so from what you can see here, guys, any other comment from your friends? No comments. Yeah, it was a good attempt, yeah, but still she need to work harder on that, because the history, I think that the part of reacting to the patient cues, I need to see more there. Okay, so this is very important, please, with the patient. Yes, you have said, I'm so sorry for your friends, okay, but a little bit of more acting would be helpful. Okay, so show this more actively to the patient. This one thing. Another thing, you have listened to her without judging her or without why you want to do something, some unnecessary surgery or something. So it was good. This is something, not judging the patient. This was good from your side. Okay, the history taking needed to be a bit structured. Okay, so how a bit structured? So it's this is an oncology, or this is a gynae case, right? Oncogynae case. So the patient herself, before you plan to either offer her something or not, you need to elicit more information about herself, her family, her risk of cancer herself. Okay, so you need to assess her risk of cancer. She had any symptoms or anything that can be worried. Otherwise, you will understand that she is a low risk. Okay, but you have to ask, you have to do this. Then you go to the gynae cancer, gynae history. Gynae history should always start by the cycles. Okay, irregularity of cycles. Yes, the contraception, the smear history, the medical history. Yes, here no medical disorder, so we wouldn't ask. Check the allergy, personal and family history of cancer. This is the most important thing. When we ask a patient in the antenatal clinic about her risk of family history of hypertension or diabetes, this is to manage this risk during the pregnancy, right? But if the patient comes for a surgery, what I'm concerned about is surgical history. I'm concerned about blood clot risk, right? So this is the important thing for me. I wouldn't be worried about hypertension, diabetes in the family history, but I would be worried about the first and the most important thing is the cancer history in the family, personal, because maybe you don't know. Maybe this patient, she was a cancer patient herself as a childhood. You don't know, right? So you need to ask. Ask about the surgical history, okay? And you can ask about the any specific history, okay? Or any significant family history you want to share with me, and that's it. Okay, but don't waste time in hypertension, diabetes, blood clots, and so on. Important thing that you will be assessed here for, that will be the family history of cancer. Okay, so this is the important thing. And how about her friends? You didn't ask much about her friend. I would like to know if this friend is a relative or not. Okay, and what is her age when she was diagnosed with ovarian cancer, because this is going to help me when I trying to calm her down. Okay, patient social history is very important. Her mental health is very important, because she might be in a state of shock losing her friend. That's why she had this idea, no, I'm going to go to have a surgery, bilateral saphenophractomy at this age. But this is not something, not very much healthy or normal. So we need to understand, maybe she had underlying mental health issues. Okay, how about her support at home? That's very important. Okay, the support at home is important. Why? Because from here you will understand if there is any hidden agenda, okay, for this patient. So mental health and support at home here are important. Okay, so I would ask like this, and I will go in the same order of the history. Okay, I start like any gynae case. I will ask about any oncology case, about any red flag signs she have. I will ask about the family history. I will ask about the fertility wishes as well, because she might have 2 children, but she's planning to have more. We don't know, right? Mode of delivery of the previous children is not relevant to this case. I would ask about the mode of delivery in the case of antenatal, a case of management of delivery. Okay, if I want to ask about a case of stress urinary incontinence recently after delivery, so I would like to know about how was her delivery. Yeah, so this thing is important. Otherwise, surgical history is enough, because if she had a previous history of like repeated cesarean section, she will tell you. Okay, yeah. Yes, Dr. Poonam, that's absolutely fine to ask about any specific risk, like was she breastfeeding or not? Was she have this induction of ovulation or not? However, okay, we can make things more simple than that to save time, okay, and to ask this patient the most important questions in the 4 minutes, because it's like a race. You're racing against time. Okay, so we gain the most important point in the information, that if we miss any one of them, that will be wrong. Okay, you will lose a mark for this, so we don't want to lose any marks. Most important thing and the priority thing in the history is required for this exam. Okay, so what is the key to answer this case, guys? Anybody would like to explain to this patient her concern? Anybody would like to continue?
Yes,
Thank you very
ma'am.
much, Rasil, for this trial. It was great that you have this courage to come in front of this case. I know it's not easy, so thank you. Okay, guys, so anybody would like to explain to our patient here? Yes, okay, so Dr. Gaia, come.
Okay. May I start, ma'am?
Okay, so what we need to do here, okay, is we have to spend 6 minutes in explaining to this patient, okay, about the story or about the bilateral saphenophractomy, and to answer her concern. Okay, so
Okay.
please let me know how you will approach this in 6 minutes only. When you're ready, I will start my time.
Yes, ma'am. Ma'am, I forgot the patient's name, Sarah.
It's Sarah, yeah.
Okay, ma'am. I'll start. May I start, ma'am?
Yes, you can.
Uh, Okay, Sarah, I know you have been through a very tough time, but after gathering the information and examining you, the risk of you developing ovarian cancer is not more than that of a general population. I really do understand your concerns and what you are going through, and I really respect them. But what happened to your friend, it does not mean that it will necessarily happen to you also.
Yeah, but
In
my friend
yes.
doctor, but
Yeah.
doctor, my friend also was,
Mhm.
what was having nothing. She was perfectly healthy.
Mhm.
We used to go to the gym daily, exercising, have a meditation, yoga, eating healthy diet, and everything. So she had no history as well. This is something come out, out of the blue and just take her so fast.
Okay. I'm really sorry, Sarah. I know it's affecting you a lot. But of course, going with such a surgery also has certain risks. Usually, we do not offer this to every woman because sometimes it proved to be more harmful than beneficial, actually. Could you just tell me, do you have any future fertility desires?
No, I think like I have completed my family. I have two lovely kids, and I would like to, see them growing. I want to live with them longer. So I think that nothing is like a cancer. So having the
Okay.
surgery will be less risky than having a cancer, of course.
I can quite understand this is quite unsettling for you. I can refer you to a geneticist as well who will talk you, who will assess you in detail about the risk and tell you the about the risk. And we will be continuously keeping in touch with you with annual checkups to so as to pick up if you have any such symptoms of developing a cancer. May I please go through the risk that can happen if we go on with the surgery with you?
Okay, so yes.
Yeah. So once we go with the surgery, there is chance that you will develop a condition just like the menopause, in which you might have hot flush, sweating, changes in the mood, dry vagina, and you might need other hormonal treatments as well, at least up to 51 years.
I'm
And
okay to take this because
okay.
I know that
Mhm.
at one time, at a certain time in my life, I will have the menopause, and this is something natural, and I have to deal with it. So I don't mind having this at 32 years.
But in this, the menopause happens at an earlier stage, so this can affect your bones as well as the health of your heart because the hormones that are produced from the ovary at present is protecting you from all this.
So
And besides,
do you have
yes,
any
please.
like hormones to take, like any tablet
E-
or any injection? So it would be
That is
like
possibility.
protective.
Yeah, that is a possibility that to protect, we can give hormone replacement therapy that you will have to continue till 51 years of age also. Apart from that, there is the risk of anesthesia as well, because as for any surgery, there could be bleeding, risk of infection, injury to the surrounding structures.
Yeah,
So
I,
these
I
are
don't mind that. I don't mind that as well because having a surgery is going to protect me. This is what I'm aiming for. I want protection.
okay. Okay, I understand. But there is a risk that despite removing the ovary, you might not be protected 100%. Still, from the lining of the tummy, there is a chance that you can develop the cancer, which we call as primary peritoneal cancer. The removal does not guarantee
What
100%.
did what? Sorry. What are you saying? The primary what?
Yeah, even after the removal of ovaries, there is still a chance that you can still develop a cancer from the inner lining of the tummy, which
Oh,
in
oh
the
yeah.
terms we call primary peritoneal cancer. So this removal does not guarantee you 100% also. Apart from that, a lot of complications. I understand your situation. I can connect you to a geneticist who will discuss in detail regarding the risk to you. In the meantime, I can give you pills, that is oral contraceptive pills. It is actually very much protective in this case. For 5 years, it protects. It gives a very good protection from ovarian cancer. Are you following me so far?
Yeah, yeah, but
Mhm.
but I think that I need to do something.
Yeah, definitely. I understand, Sarah. So as of now, is it okay if I connect you to a counselor and geneticist? Once you talk with them, you can maybe make up your mind better after that. But in the meantime, I would just ask you to reconsider your options and not to take a decision in hurry, because I understand you are totally emotionally shaken up at this moment due to the loss.
Yeah. Yeah.
Okay, I'll
Okay. So,
information leaflets. You can go through them in detail, and I'll connect you to some groups as well, and
so
arrange.
what is this information leaflet is about?
Yeah, it mainly is about the chances of getting an ovarian cancer in case you have a gene, and how to lead a healthy lifestyle, and what you can do to prevent this from happening. About the pills you might be taking.
Okay. So there is other things that I can do to
Yes,
protect
yes,
me.
yes. Of course, as I mentioned, there is this oral contraceptive pills
Yeah.
that
Thank
is.
you. Yeah. 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 Thank you. Thank you. This was very good. Okay, you come to the point at the end, but at least you have, yeah, you have come to this point. Thank you, Dia. This was good from your side. It was very good attempt. However, um, let's see. Okay, you think that your patient was happy and you have addressed her concern by the end of the consultation or not?
Not fully, she was not fully satisfied by the end, ma'am, I feel.
Yeah. You know why?
Yes, maybe I could have offered some testing, and the pills I could have mentioned earlier, the
Yeah.
protection,
Yeah. Okay.
um, and yeah. The other investigation as such for screening, TVS is not recommended as just for screening. So maybe I can offer her the geneticist who can like see for the risk which for her to develop the ovarian cancer.
Yeah. Okay. Yeah. So, dear, I'm happy that you have got the point. That's very important, and you have this, this inner sensor that, oh, the patient is not satisfied yet. So that's mean maybe there's something else it can do in the station. I hope that you can catch this earlier in the exam. Okay, and very good. You have time to work on that. Okay, so work more on that, on the part of catching that the patient is not satisfied. The patient is still, she's not happy. I didn't address her concern. Okay, so I'll tell you, or she's not convinced. Sometimes some patient will be instructed to be difficult. Some patient will be instructed, that whenever you show active listening and understanding, they will calm down and whatever you say, they can agree with you. Okay, some patients are not. So it's according to what the patient is instructed in this day to act with you. Okay, so whenever we have a conflict like this or a station like this, when the patient comes and requests something that's medically not proven, okay, or not agreed, usually as a doctor, we will not offer anybody, okay, to have oophorectomy because she's just afraid of having the chances of cancer, because every organ in the body actually can develop a cancer. So that mean we will remove everything? Of course no, right? So when we go to a station like this, communication is very important. Last thing we want to be or to have in this station is to go into a conflict with the patient when the patient arguing so much. Okay, so if the patient arguing so much, it's not good. If the patient is instructed to be difficult, so the job will be impossible. So first, work on the communication, listen, show empathy, okay, and react and respect her grief, okay, because she have lost the friend of her life recently, okay, so she's in the state of grief and she has this shock. So accept that. Something to do is after you seek a permission to the history taking, you should be non-judgmental in this case, or trying to say no, we don't offer this, of course. No, we don't agree for the surgery. So it's good good, guys, that you didn't get in this problem or this pitfall or this trap in the station. So good being non-judgmental. We have to be good counselor. So start by the explaining how low is her cancer risk, since she had no family history, she is healthy, she's having a good lifestyle, good BMI. She had contraceptive pills, which is having a protective effect as well. So we need to explain this point for her, okay? Because having contraception pills or the combined pills is here for a reason, okay? So this reason is because it's a protective effect. So we have to say that. If she is a smoker or something like that, so we need to address this. She need to stop smoking and keep on. But anyway, our patient here is really low risk. However, that's mean she had only the background risk or the population background risk, which is very low. Okay. However, no guarantee, because the patient, the role player in the exam asked, do you guarantee that I don't have cancer or I will not have cancer in the future? No, we can't guarantee, of course. Okay. However, there is some measures or strategies to reduce this risk. One of them is the surgery. Since she come with the agenda that she wants the surgery, then we discuss the surgery with her as she want. Okay, so this station, a big bulk of the marks is on discussion of the surgery. When we discuss in negotiation skills, guys, as we always say, first we have to say what is the benefit and what is the risk. Okay, why? Because yeah, theoretically, when she remove her ovaries, okay, she will have a very, very, very little chance of developing ovarian cancer or primary peritoneal cancer in the future. Still, the risk is not reduction up to 100% because of the primary peritoneal tumor, as you said. Okay, but there is a benefit. So let's agree with her. Yes, when you remove the ovaries, so you are reducing your chances of having this in the future. However, it's a surgery and every surgery has its own complication. Okay, so and a long-term implication as well, because ovaries are not there only to give birth to children or to help you get birth to children by providing eggs every once, but also it secrete important hormone to keep your, as you said, and I do agree with you, the heart health and the bone health and even the brain and the cognitive function. So it's very important for the general health. She need to understand the long-term implications. The only thing is we explain how her risk is low. Okay, we reinforce everything good she's doing, explain to her that this is our protective against cancer and this lower her chance. We give the lifestyle advice. When we discuss the surgery, we start by showing her, yes, you're correct. There is a benefit of the surgery, but also there is a long-term implication and risk. So we need to give this in her in non-judgmental way. We are not trying to affect her decision. We give her facts. Okay? So if the patient is still, she insists, we can do a genetic counselor referral if she would like to discuss with somebody, okay, about her own risk, okay, if she think that she is on, having a risk in the future. However, this is not the practice that we do for every case, but this is only if the case insists that she needs something or she needs to know her risk of having cancer exactly, okay. This is one thing. If the patient still can have the chance for another appointment, she can come and discuss with the consultant if she's still not happy after even the genetic counselor. This is, so you tell her that you're welcome to come back at any time to discuss further. Okay, so those are the lines to help in the discussion with the patient about what is a bilateral saprophyrectomy. Okay, so it's as simply, as we all know, this is the procedure to remove the ovaries and the tubes, okay? And it can be done by the keyhole surgery or open, okay? And we need to explain to her this again about the risk of this operation, okay? And whether this is suitable for her or not. Of course, this is something not suitable for her since we find that she is a low risk, okay? Potential risk here is enumerated in this slide. Okay, 1 second. Start from the immediate complication, like the bleeding, the damage to the organ, infection, thrombosis, and all, until you get the long-term complication of the menopause, of the surgical menopause. The menopause itself need to be discussed with this patient, okay, because this is the long-term consequences. And to offer her information, as you said. You know why I did ask you about the patient information leaflet, dear? Okay, because I want to check your understanding. So I'm thinking like an examiner now. I want to check your understanding of the patient information leaflet. Is it only a line you just say, or you do really understand what patient information leaflet you're going to offer in this case? So yes, well done. You have really impressed me that yes, it's about patient information leaflet about the protective measures against against ovarian cancer. Okay, she can have also more information about the surgery, okay, the risk reduction surgery, and which patient it was going to benefit from this risk reduction surgery. And she can have a website referral or something to go and read more about it. But one thing I would like to add to your plan, dear, this patient, she is in a state of grief, right?
Yes, ma'am.
Right. So do you think that this patient will benefit from talking to somebody?
Yes, yes, she will benefit with a counselor.
Yes. Yeah. So we can offer her speaking to counselor.
Yes, ma'am.
Okay. So she will benefit from some talking therapy or speaking to counselor, right?
Yes, ma'am.
Yes, that's very important. Okay, but because looks like she's not over the event, she's not over it. She's still crying for her friend. She's still, unsettled. She still wants to do surgeries and all of this. Okay, so she will need help in this case. So we can offer this help, right?
Yes, ma'am.
Yeah, thank you very much. You've been lovely today. Thank you. Well done.
So in this measures, can we ask,
Uh,
explain the other measures? That is, one is I will offer her the pills or OCPs to continue that. Apart from that, should I mention the other things like scan or CA-125 or salpingectomy or anything like that should be mentioned? Or what other measures should I tell, ma'am?
No, we will not offer her a surgery, unnecessary surgery. Okay, this is not something that we can do actually. Okay, regarding the scan, if the patient insists, because your friend recalled in some situation, however, this is very much dependent on the day, the role player, the candidate themselves. Because if the candidate is all the time trying to convince her or trying to judge her or trying to say no, surgery is not suitable for you, surgery is not suitable for you, surgery has risk, we don't do offer surgery, something like that, so the role player will become difficult. Okay, so if this happened, okay, and she want to check herself, then we can even, okay, offer her a scan. Okay, so we can do this for her, and if this is going to help her, if the patient asks specifically like I just want to check, or she had symptoms or something like that, okay, so you can just ask, offer her something like a scan, and don't offer the scan by yourself. Okay, so you can say that you're going to write back to her GP, okay,
Okay, ma'am.
to check, and if she had any symptoms or signs at any time that worrying her, that she should report to us immediately, because actually there is no guarantee that this woman have at any time any problem. Okay, so she should understand that she should report immediately any signs or symptoms of red flag signs.
Okay, thank you.
Okay, dear. But we try to avoid,
Sorry,
you know.
Dr. Rabah. In this case, because she was very afraid that she may develop a cancer, I want to ask to discuss with her about the genetic test first before going to the operation and the
She's,
risk of the
yeah,
operation.
dear, yeah, I'll tell you something, okay? Genetic testing will not be done unless the patient is a candidate for it, okay? So we don't test everybody for the genes. And our friends, the genetic counselor, okay, they start by like a family history or a personal history, you know, like a screening for the patient, okay? They have their own method to assess the personal risk, okay? And if they see that this person is eligible for genetic testing, they will run the genetic test. It's not something on the computer that we just ask for, like, okay, test for Lynch syndrome gene, let's test for BRCA gene, you know? So she will go to the genetic counselor. The genetic counselor, they will do their job. And if she is eligible, she will be tested. Otherwise, we can't promise.
Yes,
Okay?
doctor, she can do it privately. I will tell her that it is
Don't do
not
that.
funded by NHS.
Don't do that in the exam. Don't do that in the exam, please. Don't say go in private. Okay?
Because she insists and she is very afraid from cancer. She
If
maybe
you are a
get
good counselor, no, dear. If you are a good counselor and you send her to the people who can talk to her and the genetic counselor, she will not be insisting on anything. Believe me. Okay? If you speak logically with the patient and respect her and listen to her, the patient will listen to you. Okay? Because they are not trying in this exam, okay, to make you do something outside or out against the guideline. Yes, to be flexible, okay, but may I tell you something, please? If the patient found herself that she is BRCA gene 1 and 2 negative, mutation negative, you think that this is a guarantee that she will not have a cancer in her life?
no, but she will be. I can treat her stress and anxiety when she knows that
No.
she is not at increased risk from cancer than the general population. This
Yeah.
may treat her
This
anxiety.
is not your job, Dr. Asil. Dr. Asil, it's not job. Not your job, dear. Your job is to send her to genetic counselor if she insists, if she want to know her risk. There is some people, their job to do the risk assessment and to tell her her risk, okay? And this is offered in the NHS. Why we will ask the patient to go privately? Okay, unnecessary. Even the non-invasive prenatal testing in the past, when we used to say that there is a screening test, but you can do it in private, something like that. When we, saying this to the patient, it wasn't recommended to say that or to discuss that unless the patient insists. Now it's offered in the NHS, and if the people who are doing things like the commissioning group or anything, there is any test or any treatment that's not funded by the NHS, they can negotiate, the patient can negotiate her rights. Okay? But don't ask the patient to go and pay money outside the NHS in the exam. Try to avoid this. If the patient is not eligible for IVF, for example, okay, don't tell her go to private. Don't say that. Okay? So I'm sorry. For example, the patient had children before and they are healthy and everything, but she had a new partner. Okay, I'm afraid you will not be eligible for the NHS funding of the IVF. Okay, so when you say that, so means that you understand the law, right? That's it. Can I say go to private? No, I can't say. You think that both sentence has the same meaning and same implication? No. Right? No, it's not the same. One will show that you understand the law, you're not funded by the NHS. The other one is something that is not acceptable practice. So here, when you come here and practice in the UK, if you tell the patient that go to private to do some tests, that this test is useful or this test is suitable for you, but go and do it privately because NHS is not going to offer you, the patient will leave your office and she will go complain.
Yeah.
Okay, she will say, oh my God, they are denying some test or some treatment that's recommended and it show benefit. Okay, and they don't want to fund it. So have you got my point? They know the rights very well and they will never, you know, spend £1 for anything that the NHS can offer them. Okay, and the NHS themselves, they say that this is the right. Okay, so people pay huge amount of taxes every year, believe me. Okay, so they're right to be treated in the NHS. Okay, dear.
Thank you, Dr.
I hope, guys, that you got the point of the session today, and if it's helpful for you, then help me, please send the record of the discussion in 10 minutes, refined, okay, of the practice, and send it to the group. That will be very helpful to your friends and for yourself as well. You can listen to yourself before the exam. Thank you very much, dear. Thank you. Bye-bye.